Cystic fibrosis is a genetic disease that causes dysfunction of secretory glands and affects various parts of the body, especially the lungs and digestive system. Typically, mucus produced by the body is watery, but in cystic fibrosis, the mucus is thick, which causes it to accumulate and block airways. This leads to trouble breathing and lung infections. It is estimated that 1 in 3,600 children born in Canada have cystic fibrosis. This is an autosomal recessive disease, meaning that both parents must carry the gene responsible in order for that child to have the disease. An individual carry the gene without having cystic fibrosis themselves. These people are known as carriers. Approximately 1 in 25 Canadians are carriers for cystic fibrosis. Cystic fibrosis is a disorder that presents multiple symptoms that can vary in severity from person to person. The buildup of mucus in the lungs can cause infections and persistent coughing mucus. Buildup in the pancreas can also lead to decreased absorption of fats and proteins, which can cause bowel disturbances and intestinal blockage, especially in infants. Another diagnostic triad of this disorder is poor weight gain and growth in children. In adults, men with cystic fibrosis are infertile, while women face decreased fertility. Individuals living with cystic fibrosis must receive ongoing medical care in order to manage the disease. Patients must be proactive and receive checkups every 3 months. They must continually take prescribed medication and make lifestyle changes such as maintaining a good diet, continually washing their hands to lower risk of infection, drinking lots of fluids, and exercising regularly. In addition, doctors highly recommend chest physical therapy. This is an airway clearance technique which drains the lungs using various techniques such as percussion, vibration, deep breathing, or coughing. When medical management can no longer maintain lung health and function, transplantation may be the next step to improve the length and quality of life of patients with cystic fibrosis. Researchers have found that 67% of Canadians undergoing lung transplants for cystic fibrosis live at least 5 years post-surgery, and 50% live at least 10 years. Newly transplanted lungs offer better prognosis for cystic fibrosis, as patients no longer produce mucus cough or require chest physical therapy or inhaled antibiotics.